collection of data in terms of distribution of the disease. That means time, place, person. How many people are suffering from that particular disease? What are the areas affected and what is the age group? What is the sex? Clear? So, age, sex distribution, that is in terms of persons, in terms of place, in which areas, and in terms of time. Whether cases are found mostly in the winter season or whether cases are found in the early weeks or in the late weeks. Clear? So, you have to collect the data. It is called epidemiological case sheet. Epidemiological case sheet. Detailed history taking about the magnitude and spread of the disease in terms of time, place and person. Next, measure data collect করলে তাই তো epidemiological case sheet তুমি detail history নিলে rapid search for other secondary cases. Clear? Rapid search for other cases. Then data analysis. What type of data analysis? One is attack rate, another is case fatality rate. Attack rate and case fatality rate. Then 6th point, third row, spectacles, bolo. Next point. Formulation of hypothesis. Formulation of a hypothesis. Hypothesis means proposition. It may be correct or it may not be correct, but you have to establish a hypothesis based on your collected data. Clear? Next is testing of hypothesis. How? কিভাবে করব টেস্টিং অফ হাইপোথিসিস? তোমার হাইপোথিসিস ঠিক না ভুল, it has to be done by case control study or by cohort study. Testing of hypothesis. Next is summarize the report, and lastly you send the report with feasible recommendation to higher authority so as to prevent the spread of the disease. Clear? So, these are the various steps of an epidemic. Now, how will you prevent the occurrence of epidemic? এই যে epidemic টা হলো, এটা আমি how should I prevent? Prevent কিভাবে করব? You have to keep in mind that particularly the communicable diseases are spread by means of either through air or through water or through milk or through any food or through hands or through fomites in case of indirect transmission. Through fomites. Fomites means utensils or toys. Particularly in case of diphtheria, babies are playing with the toys, and another child, healthy child, he also takes part in the play with the help of same toys, and through toys the unaffected child was affected. So, toys are the fomites. So, fomites play important role in case of diphtheria. So, it is secondary mode of transmission of the disease. Not it is direct contact, but second indirect contact. It is the indirect contact. Clear? So, these are the various modes of transmission of the disease. So, you have to break the chain of transmission. Of the disease. If you break the chain, then automatically that disease load will be reduced drastically. So, if you know the reservoir or the source of infection, you control the reservoir, you eliminate the source of reservoir. Suppose if the source of reservoir is the contaminated food, then you don't distribute those contaminated food materials to the others who are not been affected till now, clear? Or if the disease is transmitted through airborne, you try to control the air pollution by means of proper ventilation. By means of proper ventilation, you will try to reduce the air pollution. Recently, Delhi is highly air polluted. Particularly, children are suffering from the respiratory tract infection, severe respiratory infection leading to difficulty in respiration, particularly children and the older people. So, government is taking necessary steps so as to reduce the air pollution. So, you try to reduce the air pollution. Use of mask. In case of a person suffering from pulmonary tuberculosis, you advise that person that you don't spit here and there. You use the mask and also you take medicines properly so that the person becomes non-infectious. If a TB patient takes medicine for 3 weeks, within 3 weeks he will be non-infectious. He will not be infectious to others. So, in this way you try to break the chain of transmission. So, one is you control air pollution, another is the diseases which are transmitted through water. What are the waterborne diseases? Cholera, typhoid, poliomyelitis, giardiasis, MBBS, typhoid, paratyphoid, bacillary dysentery. So, these are the waterborne diseases which can be prevented if you give purified water. How will you purify water? Just by adding chlorine tablet in the drinking water, or in the large scale water can be purified. And if government or if the panchayat members take initiative to distribute purified water, most of the waterborne diseases will be controlled. If we consider the milk-borne diseases can be prevented if we drink pasteurized milk. If you drink raw milk, chance of transmission of milk-borne diseases. So, in this way, we can break the chain of transmission of the disease. Next is the host, the susceptible persons. We can immunize the susceptible persons by means of vaccines, by means of various vaccines. There is active immunization and passive immunization. Microbiology pass koriye to? Active immunization, passive immunization. We can administer active immunization by means of live vaccines or kill vaccine. So, what is vaccine? Vaccine is nothing but immunobiological substances administered to a person to improve his defense mechanism against that particular antigen. Clear? I am administering BCG vaccine to a newborn baby so as to prevent the development of miliary tuberculosis, that means childhood tuberculosis or meningeal tuberculosis. We give pentavalent vaccine to prevent 5 diseases, namely diphtheria, whooping cough, tetanus, another 2 pentavalent vaccine, hepatitis B, another 5th one, influenza. So, with the help of pentavalent vaccine, we will be able to prevent these diseases, particularly under 5 children. Clear? So, breaking the channel of transmission, eliminating the reservoir. If the people are the reservoir, then we try to diagnose the cases at an early stage and give proper treatment so as to make them non-infectious. And if the person is non-infectious, his no more able to transmit the disease to others. So, in this way, we can control or eliminate disorder, we can break the channel of transmission, and we can immunize the susceptible persons by means of vaccination. Clear? So, in this way, we will control the spread of the disease and also definitely the investigation of an epidemic. In case of investigation of epidemic, medical team is sent to that particular area and he will take detailed history, he will verify whether epidemic situation is there or not, and he also defines the cases and he takes details history. The team takes details history and then he tries to analyze the data, and after that he formulate a hypothesis, and also he collects further data. It may be ecological, various important ecological data are also important, laboratory data are also important, and after that it refines the hypothesis, he tests the hypothesis, and ultimately he recommends for prevention and control of that particular disease. So, these are the various ways by which we can take various preventive measures. Another important point is isolation and quarantine. If a child suffers from diphtheria or if a child suffers from measles, the child is kept in an isolated, not isolated, he is kept in a room so as to prevent further spread to other persons until that child or that person becomes non-infectious. So, in case of isolation, the affected person, that means the diseased persons, is kept in a place in such a manner so that he does not transmit the disease to the others, and he is kept in that hospital till he or she becomes non-infectious. On the other hand, for quarantine, in case of quarantine, we keep the suspected exposed persons, particularly in the airport area or in the seaport area. How many days? For longest incubation for that particular disease. Longest incubation for that particular disease. Clear? And or if the person does not have any valid certificate, quarantine is also applied to inanimate objects like ship, airport. Ship, airport are also kept in the quarantine for the highest incubation period of that particular disease, so as to prevent transmission of the disease in the other countries. Clear? Suppose a ship was anchored coming from Africa and few persons were there who had got no valid ULVS certificate. So, that persons were kept in the quarantine in the port area for highest incubation period, that means 6 days, and vessels are also kept quarantine for that particular period, so that it will prevent spread of the disease, that means yellow fever in our country. There is no yellow fever case in India. So, if we do not take precautionary measures, yellow fever case may yellow fever case may appear in our country. So, you keep in mind what is isolation, what is quarantine, what is early diagnosis and complete treatment. Now, today you do some exercise. Probably these cases were discussed before. Incidence, you know what is incidence? This was taught before. In an outbreak of gastroenteritis among people who ate meals at a hotel, 120 people at a hotel, comma, 120. Oh, in an outbreak of gastroenteritis, JEE kore dao. In an outbreak of gastroenteritis among people who ate meals at a hotel, 120 people drank from their stored water. 120 people drank from their stored water. 40 of them developed the disease. Out of 120 who drank stored water in the hotel, out of 120 people, 40 people developed gastroenteritis. Developed the disease means developed gastroenteritis. Clear? Calculate the attack rate. Calculate the attack rate. এটা আগের দিনের ক্লাসে তো আমি বলেছি অ্যাটাক রেট। হাউ উইল ইউ ক্যালকুলেট দ্য অ্যাটাক রেট? হ্যাঁ, তুমি বললে তো হবে না পিছনে। হ্যাঁ, এই লাস্ট রো স্ট্যান্ড আপ, ক্যালকুলেট দ্য অ্যাটাক রেট। হাউ? হ্যাঁ, 33.3%. How the calculation was done? বলো তোমার বাঁদিকে লেফট সাইড। What is the numerator? What is the denominator? What is the numerator? How many people suffered? 40. So numerator is 40. What is the denominator? Out of 120. Denominator is 120 into 100. Very simple. So attack rate here is 33.3%. Clear? So in case of epidemic, you have to calculate the attack rate. This exercise is given during your final exam, and out of 5, if you calculate and you make correct answer, you will get 5. But if you do not calculate, you will get 0. Clear? Very easy. Next is secondary attack rate. Secondary attack rate. What is secondary attack rate? আগের দিন বলেছি। Secondary attack rate, number of persons developing the disease within the range of the incubation period following exposure to a primary case. Again, I am repeating. Secondary attack rate is the number of persons developing disease within the range of the incubation period following exposure to a primary case. আচ্ছা, এখানে make it a finer correction. Number of exposed and susceptible persons. Number of exposed and susceptible persons developing the disease within the range of the incubation period following exposure to a primary case. Clear? Now, suppose a family consisting of 6 members, husband, wife and 4 children. Husband, wife and 4 children. Out of 6 persons, but out of 4 children, 1 child suffered from measles. 1 child suffered from measles. So, out of other rest 3 susceptible children, 2 children developed measles after 5 or 6 days of the occurrence of primary case. So that means within the range of the incubation period, what is the incubation period of measles? 10 days. So on 5th or 6th day, Another 2 children out of 3 susceptible children, 2 children developed measles. Now calculate secondary attack rate. It is expressed in 100 out of 100. So what should be the secondary attack rate? 50. বলো কিভাবে করলে? নিউমারেটরে কত? নিউমারেটরে 3 বলো না। নিউমারেটর কত হবে? What will be the numerator? Exclude the primary case. The numerator 2. Father and mother, they are aged persons, they are already immunized against measles. Clear? So numerator 2, denominator 3 into 100 কত হচ্ছে? 66.7%. Clear? পার্কের টেক্সট বইয়ে আমি যে এক্সাম্পলটা দিলাম এটাই আছে, একটু দেখে নেবে। তাহলে কি কি বাদ যাবে? Those who are already immune, তাহলে অ্যাডাল্ট পারসন, তাহলে তারা ইমিউন, ধরে নেওয়া হচ্ছে তারা ইমিউন। প্রাইমারি কেস এক্সক্লুড, ঠিক আছে। 3 children are susceptible. Out of 3, 2 developed disease on 6th day. So secondary attack rate is here 66.6 or 7%. Clear? তাহলে কটা এক্সারসাইজ হলো? নেক্সট হচ্ছে ইনসিডেন্স রেট। হোয়াট ইজ ইনসিডেন্স? নাম্বার অফ নিউ কেসেস। ওইটুকু বললে হবে না, ইনকমপ্লিট আনসার। ইনসিডেন্সের ডেফিনিশন কি বলা হয়? ইনসিডেন্সের তো ডেফিনিশন আছে। ইনসিডেন্স, রেট, রেশিও, প্রপোর্শন। হোয়াট ইজ দ্য ডেফিনিশন অফ রেট? রেটের ডেফিনিশন কি? হোয়াট ইজ দ্য রেট? রেট, রেশিও, প্রপোর্শন। এপিডেমিওলজি ফার্স্ট চ্যাপ্টার পড়ানো হয়ে গেছে। রেট হচ্ছে অকারেন্স of an event, occurrence of an event in a population during a defined period. Occurrence of an event in a defined population during a specified period of time. ইনসিডেন্সেও কি বললো? ঠিকই বলেছে, কিন্তু partially right. Occurrence of new cases during a specified population during a specified period of time. আমার লাস্ট 1 বছরে কত গ্যাস্ট্রোএন্টারাইটিস নিউ কেসেস হয়েছে? টোটাল নাম্বার অফ গ্যাস্ট্রোএন্টারাইটিস কেসেস অফ আন্ডার 5 চিলড্রেন ইন সে লোকালিটি এক্স ডিউরিং দ্য ইয়ার 2024. ক্লিয়ার? তাহলে হাউ টু ক্যালকুলেট দ্য ইনসিডেন্স রেট। আচ্ছা, এখানে ইনসিডেন্স ক্যালকুলেট এক্সারসাইজটা লেখো। দেয়ার আর 50 নিউ কেসেস of typhoid fever in your community during June 2021. The total population of your community was 5,000 people. Calculate the incidence of typhoid in your community in the month of June 2021. June 21, calculate the incidence of typhoid in your community in that month. That means 10 হবে, ঠিক আছে। এবারে পিছনে জিজ্ঞাসা করি একটু তারা কেমন পড়েছে। বলো, what will be the numerator? বলো, what will be the numerator? বলো, numerator কি হবে? What will be the numerator? 50, বেশ। What will be the denominator? 500 না, 5,000. 5,000. What is the multiplication factor? Last row, 1,000. So for incidence, if you want to calculate the incidence, usually it is expressed per 1000. But if the disease is rare, in that case you can express per 1 lakh or you can express per 10,000 depending on the magnitude of the case. You can express, usually it is the convention to use per 1000, but sometimes if the incidence is very low, in that case we can express per 1 lakh to avoid fraction. তুমি যদি 1000 করতে পারো কিন্তু প্রচুর ফ্র্যাকশন এসে যাবে, to avoid fraction we can express per 1 lakh or per 10,000. Clear? তাহলে কি কি থাকবে ইনসিডেন্সে? নিউমারেটর, ডিনোমিনেটর, মাল্টিপ্লিকেশন ফ্যাক্টর এন্ড ডিউরেশন। এখানে কি বলা হয়েছে? ইন দ্য মান্থ অফ জুন, ঠিক আছে? তো টাইম ডিউরেশন, ইউ হ্যাভ টু মেনশন দ্য টাইম। প্রিভ্যালেন্স, হোয়াট ইজ প্রিভ্যালেন্স? কে বলবে? এই লাস্ট রো তোমার পিছনে, হ্যাঁ, হোয়াট ইজ প্রিভ্যালেন্স? মাথা এরকম নাড়লে হবে না, পরীক্ষায় পাস করতে গেলে মাথাটা একদিকে নাড়াতে হবে। ইয়েস, হোয়াট ইজ প্রিভ্যালেন্স? বলো, হোয়াট ইজ প্রিভ্যালেন্স? টোটাল নাম্বার অফ নিউ অ্যান্ড ওল্ড কেসেস, total number of new and old cases during a specified period of time, and it is expressed per 100. Prevalence is expressed per 100. Suppose if we consider the prevalence of tuberculosis, say in the last year 2024, so what is the total new cases during the period of 2024, and also what is the total old cases? You know that TB patient is not cured within a span of 2-3 weeks or within a span of 2 or 3 months. A TB patient suffers from more or less 1 year to 2 years or more than that. That's why to calculate the prevalence we consider all new and old cases during that specified period of time. That means from January to December 2024, how many total old and new cases occurred, and denominator estimated mid-year susceptible population, estimated mid-year of 2024 mid-year estimated susceptible population into 100. Clear? Now you write the incidence of brain tumor bracket A glioblastoma, the incidence of brain tumor, that is glioblastoma, is approximately 2 per 1 lakh people. Incidence of glioblastoma is approximately 2 per 1 lakh people per year. Full stop. The median survival at the time of diagnosis is approximately 18 months. The median survival at the time of diagnosis is approximately 18 months. What is the prevalence of glioblastoma? What is the prevalence of glioblastoma? Prevalence depends on two factors. One is incidence, another is duration. So if the population is more or less stable population होता है. The population is more or less stable and incidence and duration, median survival more or less same. In that case, we calculate prevalence incidence into duration. Incidence into duration. What is the incidence? 2 per 1 lakh. And what is the duration? 18 months. Convert karo year. 1.5 করলে কত হচ্ছে 3 তাই তো তাহলে prevalence is 3 per 1 lakh prevalence is 3 per 1 lakh এখানে তুমি মান্থে ক্যালকুলেট করলে হবে না ঠিক আছে ইয়ারে তোমাকে কনভার্ট করে নিতে হবে এটা মাথায় রাখবে তাহলে এটা একটু ডিফিকাল্ট কিন্তু এটা মাথায় রাখতে হবে prevalence is dependent on two factors. One is incidence. If incidence increases, prevalence will increase. Next is duration. If the duration of illness is long, prevalence will be long. So, how will you prevent the prevalence? We can treat the cases at an early stage, and if we give the complete treatment, patient will be cured rapidly. So, duration of illness will be reduced. So, naturally your prevalence will be reduced. What is the importance of prevalence? You have done an investigation and you found that prevalence of tuberculosis is very high. So, if you give early and complete treatment and if you are able to cure those infected persons, naturally the duration of disease will be shortened, thereby prevalence will be lessened. So, prevalence, the indicator prevalence tells us how many beds are required, how many hospitals are required. So, if prevalence of TB is high, you need more number of health personnel, more number of beds, more number of hospitals. So, this prevalence rate indirectly helps the planners to plan accordingly to control the disease. বোঝা গেল? সুতরাং প্রিভ্যালেন্সে দুটো জিনিস মনে রাখবে, ইনসিডেন্স অ্যান্ড প্রিভ্যালেন্স, ইনসিডেন্স অ্যান্ড ডিউরেশন। তাহলে এটা কিন্তু prevalence equal to I and D এত সহজ নয় এটা actually prevalence varies with incidence and duration. If the population is stable and if the incidence and duration is more or less same, in that case prevalence equal to I and D. Actually prevalence varies with the incidence and duration. Clear? In case of gastroenteritis or in case of food poisoning, what is the prevalence? What is the prevalence? Actually, the diseases which are of very short duration, there is no prevalence. All are incidence. So, attack rate is a special type of incidence. Attack rate or case fatality rate, these are also incidence, but these are the special type of incidence. Here we cannot calculate the prevalence, because the duration of illness is so short, either patient will recover or patient will die. Clear? So, in case of diseases which are of very short duration, there is no calculation of prevalence. There, in that case, we calculate the attack rate or case fatality rate. Clear? তাহলে কটা এক্সারসাইজ হলো? হ্যাঁ, 5টা। What is the importance of incidence? Importance of incidence? Incidence জেনে আমার লাভটা কি? হ্যাঁ, প্রিভ্যালেন্স তো বললাম একটু আগে। প্রিভ্যালেন্স হচ্ছে ফর প্ল্যানিং পারপাস, হ্যাঁ, ফর অ্যাডমিনিস্ট্রেটিভ পারপাস, হাউ মেনি বেড রিকোয়ার্ড, হাউ মেনি হসপিটালস আর রিকোয়ার্ড, হ্যাঁ। আর ফর ইনসিডেন্স, incidence gives us some idea about the etiological hypothesis. What are the causative agent? What is the source of infection? And it is how the disease is spread, how the disease, modes of transmission, source of infection, causative agent. So it is for research purpose. Clear? The incidence gives us clue regarding the source of infection, causative agent, modes of transmission, and also for research purpose. But prevalence for controlling the disease for policymakers. So prevalence is mainly for policymakers so as to cope the situation accordingly by improving the bed strength, by improving the deploying the manpower, by improving the hospital strength or providing further hospitals. Clear? So prevalence is calculated in case of illness of long duration, but for diseases which are of very short duration, in that case we do not calculate the prevalence, we only calculate attack rate or case fatality rate. Clear? What is ratio? Rate, ratio, proportion. Follow. Rate, ratio, proportion. What is rate? X is to Y. Class A. How many male students? How many female students? The ratio of male and female. So numerator is X and denominator is Y. It is the ratio of two independent variables. Ratio of two independent variables. Clear? Blood slide draw করলে কতগুলো RBC, কতগুলো WBC, ratio. Clear? What is proportion? Proportion, what is proportion? এই সকালে পাই চার্ট কে প্রেজেন্ট করলে, পাই চার্ট। In case of pie chart, he depicted one picture, a pie chart. Heading of the pie chart was expenditure pattern of the family members, say X. Expenditure pattern of a family X. Fooding purpose 60%, clothing purpose 20% or 10%, education purpose 5%, for traveling 3%, like that. So what is proportion? It is the relation in magnitude to the total. Relation in magnitude to total. আমার টোটাল যা এক্সপেন্ডিচার তার কত পার্সেন্ট ফুডিং এ খরচ হয়েছে, কত পার্সেন্ট ক্লথিং এ খরচ হয়েছে। So it is the relation in magnitude of a part of the whole. Relation in magnitude of a part of the whole. হোলের কত পার্সেন্ট বা কত পার্ট আমি ফুডিং এ খরচ করেছি। So it is the relation in magnitude of a part of the whole. Clear? So what is rate? What is ratio? What is proportion? And the basic definition যে কোনো পার্কের টেক্সট বই পাবে, যে কোনো স্ট্যান্ডার্ড টেক্সট বই পাবে। এই একটা লাইনই কিন্তু পরীক্ষায় বলতে পারছি না। রেট, রেশিও, প্রপোর্শন। রেট ইউজুয়ালি এক্সপ্রেসড per 1000, রেশিও relation between two random variables, আর proportion relation in magnitude of a part of the whole। এই তো তিনটে লাইন। পরীক্ষার সময় এটুকুই বলতে পারছি না, না বলতে পারলেও অন্তত এক্সাম্পল দিয়ে বোঝাও। ছেলে মেয়ের রেশিও কত, হ্যাঁ, আরবিসি ডব্লিউবিসি এর রেশিও কত, প্রপোর্শন আমার যত ডেথ হচ্ছে তার মধ্যে কত পার্সেন্ট ডেথ এবং আন্ডার 5 চিলড্রেন। সে 0 to approximately 80 years, 0 to 80 years যত ডেথ in Nanur block, how many of deaths, say in the year 2024, how many of deaths were of under 5 children? Clear? That is proportion relation in magnitude of a part of the whole। আমার যত ডেথ তার কত পার্সেন্ট আন্ডার 5 চিলড্রেন ডেথ, কত পার্সেন্ট above 60 years or elderly people, death of the elderly people, যত ডেথ তার কত পার্সেন্ট elderly people death, কত পার্সেন্ট infant death below 1 year, infant means below 1 year, how many infants, what is the percentage of death of the infants among total deaths, that is proportion। ডেফিনিশন যদি নাও বলতে পারো, তুমি এক্সাম্পল বললেও আমরা বুঝবো যে তুমি জিনিসটা বুঝতে পেরেছো। ক্লিয়ার? তাহলে রেট, রেশিও, প্রপোর্শন, এই তিনটে জিনিস কিন্তু একদম আইডিয়া পরিষ্কার রাখবে, আইডিয়া কনসেপশনটা পরিষ্কার রাখবে। কনসেপশন না থাকলে এই ক্যালকুলেশন করতে গিয়ে রামেরটা শ্যামের ঘাড়ে চলে যাবে, জিরো পাবে। তাহলে আপাতত এই 5টা 6টা এক্সারসাইজ বললাম, তার মধ্যে একটু ডিফিকাল্ট সেকেন্ডারি অ্যাটাক রেট ক্যালকুলেশন করা আর প্রিভ্যালেন্সটা ক্যালকুলেট করা। ক্লিয়ার?